Can anti-seizure medications like carbamazepine cause Stevens-Johnson syndrome? Catchy title, the Neurologist said it was the right drug, but the medical literature says the SJS risk was known for years. Carbamazepine is one of the most important and most frequently studied medications in connection with Stevens-Johnson syndrome. Its association with SJS has been documented extensively in medical literature, and the genetic risk factors for carbamazepine-induced SJS are among the most thoroughly characterized of any drug reaction pair in pharmacogenomics. The HLA-B 1502 genetic allele is strongly associated with carbamazepine-induced SJS and TEN. This allele is present at higher frequencies in populations of South and Southeast Asian descent, including Han Chinese, Thai, Malaysian, and Indian populations. The medical evidence supporting this association is strong enough that regulatory agencies in multiple countries, including those in Asia and Europe, have incorporated genetic screening recommendations for relevant populations into their drug approval and prescribing guidelines. The FDA updated carbamazepine labeling in 2007 to include a specific recommendation for HLA-B 1502 genetic testing in patients of Asian ancestry before initiating carbamazepine therapy. That was a regulatory acknowledgement that the genetic risk was real, that testing was available, and that failure to screen created preventable harm. Here is the legal question that follows from that history. For patients who developed carbamazepine-induced SJS before that label update, was the risk communicated adequately given what was then known? And for patients who developed it after, were prescribers actually informed about and following the updated guidance? Was the patient ever told about the option of genetic testing? The gap between what medical research established and what patients were actually told is where our legal team has focused for decades in these cases. When that gap caused harm, there is a potential claim. If carbamazepine or another anti-seizure medication triggered your SJS, please call us. We will evaluate your situation honestly and thoroughly. We offer 100% free consultations by calling 855-566-3752, or you can visit us online at www.sjslawyer.com.